Johnson & Johnson COVID vaccine now on a recommended pause. Health officials working to learn more about some rare side effects.
Yeah, the FDA and the CDC say that this is a move being made out of abundance of caution because some patients experiencing serious blood clots on the brain. Tonight we bring you team coverage. NBC4's Alan Henry is talking to doctors and their advice for people who have already gotten the J&J shot.
First up, we turn to NBC4's Adrienne Robbins. Adrienne, you heard from state officials today. How long are we anticipating this pause could last?
Brad, we're not sure quite yet. Governor DeWine says, according to the White House, they're told to be prepared for a couple of days to a couple of weeks instead of weeks to months. Now, for now, providers are being instructed to store their Johnson & Johnson vaccines and go to a different brand as soon as possible. Ohio medical professionals say the cases of these blood clots are extremely rare, and people should feel comfort in the fact that this process is a transparent and careful one. Now, until we hear more from the federal government, Governor DeWine says Ohioans should continue to get the vaccine as soon as possible.
The bulk of the vaccinations have come from the two other companies, Moderna and Pfizer. So we are going to continue to push those out as quickly as we can. We urge people to get the vaccination, and we'll see what the experts tell us in regard to Johnson & Johnson.
And thousands of those Johnson & Johnson vaccines were set to go out in Ohio this week. They will stay good until May or even June, though. Now, doctors are still concerned about what this will do to Ohio's vaccine distribution. NBC4's Alan Henry joins us now live from the Grant Medical Center to continue our team coverage. Alan, what should people do if they've already gotten the Johnson & Johnson vaccine?
Well, Adrian, doctors say the vast majority of people shouldn't be concerned. These side effects have not been spotted in 99.9% of cases, but still that tiny fraction is giving doctors and the FDA pause.
Right now, this adverse event is very rare, but we need to pause.
Dr. Joseph Castaldo says while it's not great news that the Johnson & Johnson vaccine is being paused, it is proof that the system is working.
This is the process that was set up and is playing out to really take a deep dive and to monitor for any potential adverse reactions from these vaccines.
Castaldo says even if a vaccine clears its trials, like Johnson & Johnson's did, issues can still pop up during mass distribution.
The clinical trial for J&J roughly only included 44,000 people. 44,000 people divided by 2. Half of them got the vaccine, half of them got the placebo. And in those who got the vaccine, this signal was not seen.
Despite the rarity of the side effect, Castaldo says the news will likely hurt vaccination efforts.
Regardless of what happens tomorrow, the headline's out there, and unfortunately, I do think it's going to cause a significant amount of hesitancy with the Johnson & Johnson vaccine.
But despite the rarity, there are symptoms after being vaccinated with the Johnson & Johnson vaccine that you can keep an eye out for.
Officially speaking, the recommendation is that for people who have received the J&J vaccine and develop any of the following symptoms, a severe headache, abdominal pain, leg pain, or shortness of breath, within 3 weeks after vaccination, they should contact their healthcare provider. If you received this vaccination and it's 3 weeks out, the likelihood of this rare side effect is extraordinarily low.
Now, it's possible the Johnson & Johnson vaccine pause could only last a couple days. Dr. Castaldo tells me that since these blood clots have only been spotted in younger women, the shot could be possibly brought back online and used only for specific demographics like older men. Local for you in Columbus, Alan Henry, NBC4.